Our work is to put our heads down and continue. We will not be distracted by any politics, any insinuations. We will continue supporting the people of Kano and the government of Kano State to get ahead of this. This is a time for collaboration. This is a time for leadership. This is a time for solidarity. It's not a time to point fingers. Our work is cut out for us, but we're not running away. We remain committed to achieve the task that we've set out for ourselves. We recognize it's a marathon, not a sprint, and we are committed to the mandate given to us at the Nigeria Center for Disease Control. Thank you very much.
The Secretary to the Government of the Federation, Honorable Ministers, members of the Presidential Task Force on COVID, ladies and gentlemen of the press, good afternoon. I think a lot has already been said about Kano. Just wanted to further add that we have been working very closely with our partners, specifically the UN system and the US government, to ensure that all aspects of the Kano response, particularly where we are having difficulties in terms of testing, in terms of access to patients, in terms of logistics, is sorted. And I'm very grateful to our donors for coming together and making sure we have a very coherent response. I will again emphasize the message to the people of Kano: you are not alone. The federal government will continue to take its responsibility seriously, and we will continue to work with the state government and other stakeholders to ensure that the issue in Kano is sorted out as soon as possible. With regards to other issues, particularly as it relates to state chief executives, I am, on behalf of the PTF, appealing to state governments to please continue to support the existing structures, particularly the state emergency operating centers and their chief executives as well as their staff. These people are at the front line of the pandemic. They need to be supported 100% to be able to deliver their work. And specifically, we would like to re-emphasize that there is no limit to testing. There is no limit to testing when it comes to COVID. COVID numbers is not an issue of competition between states. There is no shame if a state comes up with positive numbers. In order to deal with an epidemic, we need to have transparency in numbers. And that transparency is linked to the number of tests. If you do not know the extent of your problem, you will not be able to deal with it. So I'm appealing to state governments to please continue to support the state emergency operating centers, the state ministries of health, to make sure that everybody who needs to be tested for COVID in any state in the country has that opportunity of having the test done. In addition to this, we would like to further remind state governments that there are a number of states that continue to have inadequate bed capacity for isolation. Now is the time to correct this before the numbers start going up. So please, the state chief executives, I'm appealing to them to please make sure where you do not have adequate isolation facilities to do so. The PTF has already put 300 as the expected minimum number of isolation beds that should be available in every state. In terms of public awareness, we continue to intensify efforts to support the fight against COVID-19 across the nation. We have reached out through a sensitization campaign, working with our traditional and religious leaders, as well as existing health structures such as the polio eradication program, to reach the grassroots with our messages. The task force is also implementing training programs for health media reporters on effective messaging and COVID-19 reporting. Finally, I would like to encourage Muslim faithfuls to continue to comply with the Ramadan protocols. The task force continues to run communication campaigns down to the grassroots on observing the holy month of Ramadan in the safety of our homes. Thank you.